Okay, there we go. Okay, in July 1 of this year, we came out with a new nail exam, and it's certainly different, just like our new aesthetics exam is different. It, however, will only go in effect, January 1 of 2021. Our subject matter experts have done a great job with this. There's a new area in here, and here again, it's going to be a little different than what you're accustomed to. But I would encourage you to continue doing exactly the way that you've been taught until January 1. And at that point, prior to going to that board or your students going to that board, make sure they have downloaded a new copy, get it from your state, and then they'll be ready to go with the new nail exam. Give me 1 second to take a swallow of water and I'll be right back with you. Okay, so our candidates are in place and they're told, you will prepare your work area for your client. You will set up the universal supplies you will use throughout the examination. You will also set up the supplies for the manicure and polish application. You will prepare your client for the services. You will be expected to follow all client protection, safety, and infection control procedures. You will have 15 minutes to complete this section. You will be informed when you have 8 minutes remaining. Do not demonstrate any procedures until the verbal instructions are given and you are instructed to begin. Turn the hand toward the examiner to indicate you have finished. The instructions will be repeated. The candidate is then told, you may begin. So, in 1.1, your examiner is looking to see that they do disinfect all work areas completely with product labeled in English as an EPA-registered bactericidal, fungicidal, and virucidal disinfectant. Here again, in this exam, our candidates are expected to wear gloves during the disinfection procedure. And very honestly, for the people that just strictly teach cosmetology or barbering out there, I would tell you that I really expect this to follow suit with our exams as they come out. We are in the process of always developing new exams. We're in the process of working on a new cosmetology exam. And Wayne and I both feel pretty confident that those subject matter experts will include wearing gloves for the disinfecting process. So you might want to go ahead and implement those into your regular procedure. Most of, if not all of your disinfectant wipes will tell you to wear gloves during the disinfection procedure anyway. So it's just good to go ahead. We're implementing it into our national exams. And if I were you and owned a school or were an instructor, I would go ahead and get my candidates accustomed to doing that because it's probably, and here again, you have to remember the cosmetologists write our cosmetology exam, estheticians write our aesthetics exam, and our nail technicians and barbers write their exams. With that being said, Wayne went over the basic facial with you this morning or earlier today for cosmetology. That will not change until the cosmetologists change it. So in other words, even in January 1, the basic facial for cosmetology, the sculptured nail will stay the same as it is. The cosmetologist, when they rewrite this exam, will have the option of looking at the aesthetics and the nail exam and see if they want to change it. They may decide to leave it, they may decide to change it, or they may even come up with even another method or procedure for those. So it's entirely up to the cosmetologist, but even in January 1, I want to emphasize that the cosmetology facial, the cosmetologist sculptured nail will remain the same as it is today. That being said, we're going to disinfect our work area completely with product labeled in English as an EPA-registered bactericidal, fungicidal, and virucidal disinfectant. And here again, we mentioned to you earlier that we're no longer using the term hospital grade because the government has discontinued their use and they're calling it the same as we are now. They're going to discard those gloves into the trash, and we do want them to sanitize their hands with product labeled in English prior to going into their kit and remove those universal or general supplies that are labeled in English. In 1.4, your examiner is looking, of course, to see that items to be disinfected, soiled linens, and trash are disposed of in a correct manner throughout that section. When all the hands have been turned toward our examiner, our proctor is going to say, all candidates have indicated they have completed this section of the examination. We will now proceed. And then our candidates are told, you will perform a manicure and polish application. Okay, folks, here again, when the subject matter experts developed this exam, they said we don't really need to teach a manicurist or a nail technician how to do a manicure. They're coming for a license and they should already know how to perform that. So this is a lot different than what you're doing right now. At least the verbal instructions are different. Okay, you will perform a manicure and polish application. You will be expected to follow all client protection, safety, and infection control procedures. You will have 20 minutes to complete this section. You will be informed when you have 10 minutes remaining. Turn the hand toward the examiner to indicate you have finished. Instructions are repeated. The candidate's told, you may begin. So your examiner is looking to see that those manicure supplies are labeled in English, that any implements and supplies are visibly clean. They would be, of course, looking to see that the files and buffers and orangewood sticks or birchwood sticks, if they want to use one, are new without file marks. Everything is clean, that all the supplies as well as those implements are without dirt or debris. And then in 2.3, we want them to perform a basic manicure. Now here again, that manicure is the same that you're doing today. We want them to make sure that they are filing, that they're holding a finger at the side wall while they are filing. We want them to push the cuticle back. We want them to immerse the fingers in a bowl of water. We want them to clean under the free edge. We want them to apply a massage product. We want them to massage the hand, and then we want them to prepare that nail, prepare the nails and apply red polish. Okay, so looking at that, let's talk about preparing the nails and red polish. Our exam does require a base coat and a top coat. We know that there are products out there that are multi-use, I should say, and they're both a base and a top coat. We don't have a problem with that. A candidate could bring in both a base and a top, or they could bring us in a polish, a clear polish that says base/top, and we would expect that candidate that was the product that's in there. We do want that candidate to apply red polish. And folks, just so you know, red polish means red polish to us. It means fire engine red. We didn't say a shade of red, and we didn't say a tint of red. So I wouldn't be expecting a pink, nor would I be expecting a burgundy, but I would be expecting fire engine red, okay? We're not looking at the number of strokes that that candidate applies that polish. That is a technique. We're not looking at the number of coats of polish that they utilize. We also know that there are polishes today that you don't need a base or a top coat. Our exam is requiring a base and a top, just so that you're aware of that, okay? When all the hands have been turned back toward our examiner, our proctor would say, all candidates have indicated they have completed this section of the examination. Please do nothing until the next verbal instructions are given. And then at that point, your examiner is going to go over, they're going to look at the final appearance of that manicure and the final appearance of the polish application. So they're going to be looking to see, are there file marks or on the cuticle or the surrounding skin of that manicure? Did they get polish on the cuticle or the surrounding skin? Are there bubbles? Are there streaks? Are there, is it smudged? Can they see the nail plate through that polish application? You know, they're going to do that just like you would were you to go in for a manicure and come out and look at your manicure. They would be doing the same thing, checking the polish and the final appearance of that manicure. They're then going to turn that hand back to your candidate and tell that candidate, please do nothing until the next verbal instructions are given. They're going to step back. They're going to make their assessment and record that assessment. And then they're going to candidate number 2 and go through the same process. And then they're going to tell candidate number 2, please step back and do nothing until the next verbal instructions are given, until everybody has been assessed. When everybody has been assessed, our proctor will say, all examiners have indicated they are ready to proceed. You will remove the polish from the nails and properly dispose of the supplies used in the previous section of the examination. You will be expected to follow all client protection, safety, and infection control procedures. You will have 5 minutes to complete this section. You will be informed when you have 2 minutes remaining. Turn the hand toward the examiner to indicate you have finished. So at this point, I'm telling you, your examiner is looking to see what you do with those products that you've utilized in the previous section. That polish, you're through with the base coat, you're through with the top coat, you're through with the cuticle remover, you're through with that orange wood stick. All of those need to go into the appropriate container. The appropriate container for the orange wood stick would certainly be the trash for files and emery boards and that sort of thing. For your polish, for your cuticle remover, all your manicuring bowl, all of those would go into items to be disinfected. Okay, then our candidates are looking to see where they are putting those. They're also looking to see, as they remove that polish from the nails, did they use an orange wood stick, and did they lay that orange wood stick or the cotton that was used to get into the cuticle area and clean that cuticle area, did they lay it on the table, or did it go directly into the trash where it should have? They're looking to see that items to be disinfected, soiled linens and trash are disposed of throughout that entire section. All candidates have indicated they have completed this section of the examination. We will now proceed. And then the verbals are given to examiners. Please rotate at this time. Our candidates are then told, you will prepare your work area for a new client. You will set up the universal or general supplies you will use for the remainder of the examination. You will also set up the supplies for the following sections of the examination: nail tip application and blending, sculptured nail service, and here again, a new section, the removal of the sculptured nail. You will prepare your client for the services. You will be expected to follow all client protection, safety, and infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Do not demonstrate any procedures until the verbal instructions are given and you are instructed to begin. Turn the hand toward the examiner to indicate you have finished. Those instructions, of course, are repeated. The candidate's then told, you may begin. In 3.1, we're looking to see that they do disinfect all work areas completely with product that's labeled in English as an EPA registered bactericidal, fungicidal, and virucidal disinfectant. Here again, we are expecting that candidate to wear gloves during this disinfection procedure. At the end of that, we want them to throw those gloves into the trash. We want them to sanitize their hands with product and go into their work kit and remove the universal supplies, which are labeled in English. All the while, we're looking to see that items to be disinfected, soiled linens, and trash are disposed of in the correct manner throughout that section. If all the hands have been turned toward our examiners, our proctor would say, all candidates have indicated they have completed this section of the examination. We will now proceed. And then our candidates are told, you will perform nail tip application and blending. You will apply the nail tip to the whatever finger that the proctor determines at that time. You will be expected to follow all client protection, safety, and infection control procedures. You will have 20 minutes to complete this section. You will be informed when you have 10 minutes remaining. Turn the hand toward the examiner to indicate you have finished. Those instructions are repeated. The candidate's then told, you may begin. And so your examiner is looking to see that the nail tip application and blending supplies are labeled in English and that any implements and supplies are visibly clean, meaning without trash or dirt or debris. In 4.3, we want them to prepare the nail tip for application. That should include buffing that nail, as well as removing the shine and dehydrating that nail tip, that hand prior to the nail tip application. We want them in 4.4 to select a full weld tip and attach it to the nail plate of the finger that was assigned. And that should, here again, is a full well tip, not a half well, not a no well. It is a full well tip. And we realize that that takes good practice and that it can be difficult, and they may have to file the full well tip down in order for it to not extend further than halfway down the nail play. In 4.5, after it's been adhered, we want them to trim, to shape, and to blend that nail tip. When everybody has turned their hand toward the proctor or toward the examiner, our proctor would say, all candidates have indicated they have completed this section of the examination. Please do nothing until the next verbal instructions are given. At that point, your examiner is going to walk over. They're going to pick up that hand with their gloved hand. They're going to run their finger around the free edge of that nail tip. Does it grab that glove? Is it smooth or is it even? They're going to look and see, is there adhesive on the cuticle or the surrounding skin or even on the hyponychium? Does it fit from sidewall to sidewall, or is it too narrow or too short? They're going to run their finger across. Is it blended so that they don't still feel the ridge there? Is it over blended so that the tip has been disintegrated? They're going to make a good assessment, just like you would if you were to break a nail and go into the salon and say, I broke a nail. Can I get a nail tip put on this finger? They're then going to turn that hand back toward your candidate, tell them, please do nothing until the next verbal instructions are given. They're going to step back and make their assessment. They're then going to go to candidate number 2 and go through that procedure. And they're always looking, of course, to see that items to be disinfected, soiled linens, and trash are disposed of in the correct manner throughout all of our sections. When everybody has been examined, they're going to say, all examiners have indicated they are ready to proceed. And then they're told, you will sculpt a nail on the whatever finger that the proctor determines at that time. You must use a manufactured sealed, low odor, less odor product. Now, I will tell you, they will be checking this product before the exam begins. So make sure that it is sealed and factory sealed. I was in an exam not long ago. There were 8 candidates for this. It was not your state, but actually the proctor picked up, I think, 4 or 6 different monomers because they were not factory sealed. So make sure that it is factory sealed and check with your state for specific guidelines for your product requirements. You will be expected to follow all client protection, safety, and infection control procedures. You will have 20 minutes to complete this section. You will be informed when you have 10 minutes remaining. Turn the hand toward the examiner to indicate you have finished. Instructions are repeated. The candidates are told, you may begin. In 5.1, we're looking to see that they do set up the sculptured nail supplies. The products must be in their original container and must have a manufacturer's label in English. Now, folks, they will need to remove those sculptured products from their original container, and they need to put those in a damping dish. They cannot pour just the monomer out and then work out of the original container with the powder. And let's just talk about powders and things today. I know that a lot of nail techs like to use or to do the French manicure. Some like to use the clear, some like to use just the white. But if you're a nail technician or doing a lot of nails, you know that sculptured material is available in every color of the rainbow: blue, green, yellow, orange, black, white, etc. We do not have a preference for that. That's entirely up to you and your candidate, the product, the color that they bring in there. Also, we know that there are products on the market that are no longer requiring a primer. In this exam, beginning in January 1 of 2021, we will not be requiring a primer. As of today, and until that day, we do require a primer in our exam. Okay? So if your product line that you're using does not require a primer after July 1, you don't have to use a primer. Excuse me, January 1, you don't have to use a primer. Okay, so those products have been dispensed into their damping dish. And here again, folks, we know that there are all kinds of forms: paper forms, metal forms, plastic forms. We don't have a preference with that. We want your candidate utilizing what they're comfortable with. And we're not looking for the number of balls that they have to make. We know that there are a lot of good nail techs today that can make a sculptured nail using 1 ball of product. There are others, maybe even like myself, that it takes 57 balls to form that, but we're not counting the balls or the technique. That's entirely up to them. So they have prepared the nail plate for the sculptured nail. They've taken off the shine. They've dehydrated that. That could have been with a professional product like Bond-Aid or Bond-X. It could have been with a product maybe like alcohol or hand sanitizer to utilize that, to dehydrate that nail plate further so that they would get a better adhesion. And in 5.4, they're going to sculpt that nail to extend the free edge of the finger that was assigned. And once that's gone through the polymerization process, folks, we do want them to cover those damping dishes prior to beginning the shaping and filing of that finished sculptured nail. So a lot of damping dishes come with a cover. If theirs don't come with a cover, or it doesn't have a cover, simply cover them with a cotton round, a paper towel, tissue, whatever they have available, but just cover prior to beginning the filing and shaping process. And in 5.5, we do want them to shape, contour, and finish that sculptured nail. They do need to add oil to that sculptured nail and buff that nail smooth. When all the hands have been turned toward our examiners, our proctor is going to say, all candidates have indicated they have completed this section of the examination. Please do nothing until the next verbal instructions are given. At that point, your examiner is going to come over with their gloved hand. They're going to pick up that sculptured nail or hand and look at that sculptured nail. They're going to look at it head on. Does it have a nice curvature to it? They're going to look and see, is it tapered? They're going to run their finger around the free edge as it's not smooth and tapered and grabs it because it's rough, meaning the free edge. They're going to run their finger across the surface of that. They're going to look and see if there's product on the on the cuticle or the surrounding skin or even the hyponychium. They're going to look at that nail and just make a good assessment, just like you would were you to break a nail and go into the salon and say, I broke a fingernail. Can you put a sculptured nail on this finger? They're then going to turn that back toward your candidate and tell them to please do nothing until the next verbal instructions are given. All the while, they're certainly looking to see that items to be disinfected, soiled linens, and trash are disposed of in the correct manner throughout that section. When everybody has been assessed, our proctor is going to say, all examiners have indicated they are ready to proceed. And this is a new section. And so let me talk about that, the removal of the sculptured nail. When we did our survey for the nail exam, we got a lot of response back saying one of the biggest issues we see in our industry, and these were by licensees already, is we're seeing people come in that have had gel nails or sculptured nails removed, and their nails plates are beat all up, and the surrounding skin is beat all up or beat up. And so it was decided by the subject matter experts that if this is an issue that they're seeing in the industry and we're trying to protect the public, that we should include the removal of the sculptured nail in our exam. Just so that you know, we always do run-throughs to make sure that we can work within the time frame of this, to make sure that the acetone didn't dissolve our hand, whether it be plastic or metal, or plastic or rubber. And we had no issues with this. So I don't want anybody being concerned, oh, it's going to dissolve the hand. Oh, it's going to dissolve the finger. Oh, it's going to dissolve the tip. I'm going to talk about that as we get into the exam. We're wanting that candidate to know what they should do and how they should remove a sculptured nail. And I am going to talk about that. So they're told you will perform a removal of the sculptured nail. You will be expected to follow all client protection, safety, and infection control procedures. You will have 20 minutes to complete this section. You will be informed when you have 10 minutes remaining. Turn the hand toward the examiner to indicate you have finished. Instructions certainly are repeated. The candidates are then told, you may begin. So the candidate will be evaluated on the following task. And your examiner is looking to see that in 6.1, the sculptured nail removal supplies are labeled in English, and in 6.2, the implements and supplies are visibly clean. In 6.3, they remove the sculptured nail. So let's talk about that. I'm going to give you two ways in which I would encourage that to happen in the exam site. The first one, I would bring, if I were that candidate, I wouldn't bring just a small damping dish. I would bring probably a small custard cup. Most of us have those in our kitchen cabinet, and something that's a little larger than a damping dish. I would take a black file and I would rough up that sculptured nail and remove that oil that I just placed on earlier to make it smooth and finished. And then I would rough it up, and then I would put that finger down into the acetone. Occasionally I would lift that up and I would push that product, dissolved product, away from the cuticle down toward the free edge. I would then probably hit that nail again with a file, and then I would immerse it again. And I would keep doing that until that product were removed. Once it were removed, and I might have to, at the very end, go ahead and file that, the remaining product off of that. Then I would go ahead and make sure that we're going to condition the nail and the surrounding skin because of the removal of that product. Okay, so we're looking to see in this exam that they don't take an orange wood stick or a metal pusher and try to pry that off. We're looking to see that they're not going to take the nippers and try to clip it off. We're looking to see that they're going to effectively remove a sculptured nail and condition the skin and the nail that would have been left behind on that mannequin. And okay, that's scenario number one. The other way that I would do that, the other way, I would file that nail to remove the oil and to remove that smooth finish off of there. I would take a large cotton round of cotton ball. I would immerse that or get acetone on that. I would place it on that sculptured product, and I would wrap foil around that. I would then remove that. I would push that product away from the cuticle area down toward the free edge. I would take my file and buff that nail up, and then I would reapply that cotton ball and make sure, and then put the foil over it. I would keep rotating back and forth that until the product were almost removed. Pardon me. Making sure that I'm not trying to pry it, I'm not nipping it, I'm not trying to push an orange wood stick or a metal pusher underneath it and the nail plate to pry it off or to push it off in any way. And then at the end, I want them to see, them to buff that natural nail and condition the nail and the surrounding skin. Okay, so with that being done, give me just a second. Whoops, went too far. All candidates have indicated they've completed this section of the examination. Please do nothing until the next verbal instructions are given. Okay, and so what's going to happen is your examiner is going to come over and they're going to pick up that hand with their gloved hand, and they're going to assess the removal of the sculptured nail. Now, I told you we had several run-throughs, and we had no problem with the nail. If it were to actually dissolve the tip that's underneath there that the candidate brought with them to the exam, it's okay. We're not looking for that. We're looking to see that that candidate does not push, pull, tug, nip that product. We're looking to see that as at the end of their removal process, that they know to condition that nail as well as the surrounding skin with an oil, with a lotion, with a cream to make sure that it is conditioned. If the whole tip goes away, we have no problem with them going on and going ahead and doing that procedure to just the naked finger. Okay, so then they're told, please do nothing until the next verbal instructions are given, until everybody has been assessed. All the while, your examiner would be looking to see what they did with items to be disinfected, soiled linens or trash in that complete section. Our candidates also have a blood exposure procedure that is a little different as well. Our candidates are told, you will demonstrate the blood exposure procedure. You will imagine the following scenario. During a service, you have sustained a minor cut to your index finger. The injury is such that you can continue with the service. The injury has not yet contaminated your work area or the client. You are expected to demonstrate the proper procedure for a blood exposure. You are expected to follow all client protection, safety, and infection control procedures. You will be instructed individually by the examiner to demonstrate the blood exposure procedure. You will have 5 minutes to complete this section. You will be informed when you have 2 minutes remaining. Do not begin to demonstrate the blood exposure procedure until instructed individually by the examiner to do so. Turn the hand toward the examiner to indicate you have finished. Okay, so in developing this exam, the subject matter experts were told that nail technicians, for whatever reason, were not doing well or as well with the blood exposure procedure. And so it was determined to do that on a one-to-one basis instead of doing it as a group. So they will be looking to see that the first aid supplies are labeled in English. Let me back up just one more time. What's going to happen is that they're going to walk up to your candidate and they're going to tell them, please demonstrate the blood exposure procedure. They'll be looking in 7.1 to see that the first aid supplies and materials are labeled in English, that they remove the materials from the first aid kit. They can do that by sanitizing their hand or putting on one hand and doing that with a one-hand procedure, or they may put a glove over the injured hand and go to the kit. They're going to be, the examiner is going to be looking to see that the supplies and the materials are visibly clean. They're then going to remove that glove and then they're going to clean that injured area with an antiseptic. They're then going to cover it with a dressing that is absorbent and secured. They're going to dispose of all contaminated supplies. And then we're looking to see that the candidate protects the injury with a glove, with a finger guard, or a finger cut. They're told, please do nothing until the next verbal instructions are given, and then they'll go to candidate number 2 and tell them to perform the blood exposure procedure until everybody has been examined. All examiners have indicated they have completed their assessment. Make sure that all kits, supplies, and disposable materials are taken with you. This concludes the National Interstate Council of State Boards of Cosmetology National Nail Technology Practical Examination. Thank you for your participation.